Marks is up here first, so give me a little second and then we'll be ready for you.
Okay, that's fine.
Okay, ready.
Good afternoon. My name is Cesar Cortez. I'm here to represent my team as the affirmative. Today's debate topic is on whether or not we should enforce vaccines across all college campuses. COVID-19 is something that has taken a toll on all of us, from moving to online classes, to wearing masks, to keeping 6 feet away from everyone, to losing friends and family, to living in fear. COVID has completely changed the lives of every single person in this room. Ladies and gentlemen, what if there was a way to prevent this from getting any worse, right? In this fear, reunite as families, return to regular in-person classes, and finally return to the life we once knew. Well, so I have great news for all of you. There is a way to prevent COVID from taking more from us than it already has. As of 2020, vaccines have been rolled out and become available to anyone willing to become vaccinated. These vaccines have all been approved by the FDA and the World Health Organization. And the CDC has stated on the website, the purpose for the vaccine is, and I quote, to keep you from getting and spreading the virus that causes COVID-19. So the good news is we have vaccines that have proven to slow down the spread of COVID. Ladies and gentlemen, we the affirmative urge the enforcement of a vaccine mandate across all U.S. colleges and universities for students, faculty, and staff. This is all in an effort to slow down COVID from spreading anymore, keeping our community safe, and preventing COVID from mutating into different variants. Now, what would this mandate look like? Essentially, in order for students to participate in in-person learning, they would need to either show proof they are fully vaccinated against COVID or become fully vaccinated. In the event that a student decides to not become vaccinated, they would be offered the alternative option of online learning. For faculty and staff, if they wish to work on campus, they will also need to show proof of vaccination against COVID or become fully vaccinated. Part of the mandate is that there are both religious and medical exemptions. For medical exemptions, in the event that a COVID vaccine would put one at medical or health risk, and once approved for exemption from a doctor, the university or college would exempt their requirement for becoming vaccinated. For religious exemptions, Title VII of the Civil Rights Act of 1964 states that a worker can request an exemption for a job requirement if it, and I quote, conflicts with their sincerely held religious beliefs, practices, or observances. Now, this would apply to traditional religion, non-formal, new and uncommon religion, and beliefs. However, personal, social, political, and economic beliefs are not considered for exemption under Title VII. For students granted with religious and medical exemption, they will need to take a COVID test once per week and test negative to continue in-person learning. The same would apply to faculty and staff. They must also test negative in order to work on campus. Ladies and gentlemen, when college is being packed with students, events, sports, and so on, it is no question why the New York Times is calling colleges and universities heavy spreaders. And with over 47.4 million cases of COVID in the U.S. and an estimated 766,000 deaths as a result of COVID, we urge the implementation of a mandate across all U.S. colleges and universities. In addition to that, a data analysis released by the Associated Press released new staggering information concerning those who choose to not become vaccinated. The Associated Press has concluded that you have a higher risk of dying when you compare to those who are unvaccinated. That statistic being that 99 to 98% of those dying as a result of coronavirus are in fact unvaccinated. Extensive research and countless data from the CDC has made it very clear that our best fight against COVID is in fact becoming fully vaccinated. I want to end off by reminding everyone that as students, we are the future. Future doctors, future lawyers, engineers, and so on. Making it essential for students to receive the best education possible. That education taking place inside a physical classroom as opposed to online learning. Faculty and staff are just as essential to education as they lead students into their future and create lasting impacts on students. In conclusion, ladies and gentlemen, a mandate across all U.S. colleges and universities is one of the essential steps we must take in an effort to slow down the spread of COVID, create safer communities, and return to life as we once knew it to be. Thank you.
My name is Patrick Sherwood. I am the first negative speaker for this debate. All public colleges and universities should adopt COVID-19 vaccine mandates. A vaccine mandate, then, is a law or institutional policy that requires certain groups of people to have received a vaccination against a specific disease or a qualified exemption to said vaccination. And of course, this is a broad definition. It can cover faculty, students, staff, or any combination thereof. Our position is not against vaccination in every case. However, instituting a COVID-19 vaccine mandate in all public colleges will not lead to a reduction in cases among students. It is also unethical to force students who are against receiving it to do so in absence of a qualified exemption. Lastly, recent reports show a national decline in COVID-19 cases despite the resumption of in-person education. This indicates that our current level of protection against the disease is sufficient. The coronavirus vaccines have a mixed reputation when it comes to their effectiveness, especially when considering recent evidence from the CDC that shows vaccine effectiveness for infection protection fell from roughly 91% to 66% after emergence of the Delta variant. Another CDC report published August 6 of 2021 tracked 469 COVID-19 cases linked to public events in a town in Massachusetts. Of these, 346, or 74% of them, occurred in fully vaccinated individuals. Out of 5 hospitalizations, only 1 occurred in someone who was unvaccinated. The study does not define how many of these cases were asymptomatic. In fact, it's mentioned that the number of asymptomatic cases in vaccinated individuals could be underrepresented due to detection bias. We know that vaccinated people also contract and spread COVID. Since the vaccine mitigates symptoms and decreases the likelihood of death or hospitalization due to the disease, then it is likely that there are vaccinated individuals carrying and unknowingly spreading the disease asymptomatically as they go to class or social events on campus. For this reason, a vaccine mandate would not be effective in reducing the caseload among college students. Furthermore, finding cases of COVID within a community does not automatically translate to a significantly higher risk of everyone contracting or dying of the disease. There are many other factors, such as your age, your overall health, pre-existing conditions, to consider when you are calculating your individual risk from the disease. The phenomenon of antibody-dependent enhancement, or ADE, is one example of an unintended consequence of vaccination that is still under scientific investigation. Antibody-dependent enhancement is a phenomenon which can increase the severity of certain viral infections as a result of vaccination. It's observed in 2 infections caused by other coronaviruses similar in structure to the SARS-CoV-2 virus, SARS-CoV responsible for the 2002-2003 outbreak of SARS, and MERS-CoV responsible for the outbreak in the Middle East in 2012. To further support the possibility of ADE in coronaviruses, a series of experiments were conducted in 2014 and published in the BMC Virology Journal. These experiments conclusively demonstrate that anti-spike serum promotes internalization of SARS-CoV by human macrophages. This means that vaccines designed to elicit an immune response specifically to the spike protein in the SARS-CoV-1 virus carries the risk of causing ADE of that virus. This does not necessarily mean that the same risk will absolutely apply to vaccines designed for SARS-CoV-2, but it does make further scientific investigation, particularly as these viruses share about 80% of their sequence identity, necessary. The risk of serious side effects like ADE and myocarditis, which we will discuss later, showing up after vaccination is relatively low. And at the same time, the risk of complications or death to college-age students due to COVID-19 infection is also quite low. Considering the recent decreasing trend of cases, we can surmise that our defense against repeated significant outbreaks is robust. At this point, a vaccine mandate seems superfluous, and according to researchers studying the prevalence of myocarditis, if the rate of COVID-19 was to fall to levels seen in June 2021, there would be more vaccine-associated myocarditis cases than COVID-19 hospitalizations. As the disease progresses to a more manageable phase, we must maintain awareness of other societal issues and health problems that affect Americans rather than continuing to exacerbate these issues because of a disease that, again, poses minimal risk to college-aged individuals. This brings me to my next point. In a healthcare system as convoluted, expensive, and corrupt as the one in the United States, seeing a doctor is simply unattainable for some due to financial constraints. And these people are being told that the vaccine is safe and effective. They're being pressured by news, social media, by family, politicians, and friends to get vaccinated. And our health is a personal aspect of our lives. I believe with the limited data we have available, vaccination should be on a voluntary, case-by-case basis, allowing each person to evaluate their own risk potential with their doctor and make their decision accordingly. Thank you.
Okay, now we're gonna do our first crossfire. So can I get this out of Patrick, please?
I'd like to have the first question, please.
Sorry.
I'm sorry.
I think this time we're going, no worries. Okay, sorry, go ahead.
Okay, yes, ma'am. So, in your speech, you did mention that getting vaccinated will not cause a reduction in COVID cases, with the CDC showing countless evidence and proof that it's also getting vaccinated is also fighting against the Delta variant. If you're stating that getting vaccines does not slow the reduction down, what would you predict would happen for those who aren't vaccinated and are affected by the Delta variant?
I would predict that the disease would go through their body and their body would either fight it off or they would suffer complications that would lead them to go to the hospital. It is entirely possible, and that's entirely possible for someone who is vaccinated as well. Does that answer your question?
Yes, sir.
In your speech, you said that anyone who chose or was exempt from the vaccine mandate would be required to be tested on a regular basis. Who would provide this testing? Would it be free?
Yes, there are a lot of free areas you can go. Some of them being college campuses. CVS is one of the very popular ones where you can get your vaccine for free. Same would apply to those who are vaccinated as well. It is important for everybody to remain, to test negative. So, does that answer your question?
Yes, it does.
Okay. You did mention that the people are being pressured to get vaccinated, being that all this information is public and published by the CDC. Just curious as to what you mean by being pressured to get vaccinated.
Well, what I mean is we see essentially a mass marketing campaign for vaccinations. You see it on YouTube recommended, on Facebook if you have that. I don't really have social media, but you see it anytime I even open my phone, I can see a banner ad at the top of whatever app I'm using that tells me things like that. And it seems very disingenuous to me, and it makes me not want. Oh, that was time.
Yeah.
Oh,
Sorry.
thank you.
Okay, Rich?
Start.
Let us start when we start talking. Or I can give you a countdown. Or you can start.
So vaccine mandates are effective. The COVID-19 vaccine has been tested by tens of thousands of people from different races to different genders to different ethnicities and ages. Results from the trials have shown that the vaccine is very effective and is safe against what a lot of people are afraid of coming from it, like hospitalization and death and certain things. Low vaccination rates in America have shown to lead to outbreaks. And outbreaks, as we know, give the virus an opportunity to attract new variants. There are new reports of new strains across the world, of new variants, like the B117 found in the United Kingdom, B135 found in Africa, and the P1 found in Brazil. These strands across the world are very transmissible and are easy to come about if people are not vaccinated in America. Many colleges have slowly started to provide vaccines and mandate vaccines across the country. Colleges like the University of Miami, It's the biggest school right now to mandate them. And many other schools like Delaware and University of Georgia are mandating them for their employees. And vaccine mandates have been positive in the past. Cases like measles, mumps, meningitis shots that are used to be widely spread. Those in the past have been mandated and they've been proven successfully to work. You said there's no point to mandate vaccines because they can also another example would be Tyson Foods. This isn't a college, but it's an example. They made a mandate in August with less than 140,000 employees unvaccinated. And when the deadline came to an end, more than 60,000 additional employees were vaccinated, which brought their vaccination rate to 96%. They had seen a big decline in COVID-19 cases since then. And that is just one example of a company with a lot of people, like colleges, that have a lot of people and that need to be vaccinated, and their rates went down. Vaccine mandates in college, mandating a vaccine in college will bring a lot of positivity to colleges, and I would think that mandating the vaccine will change how kids learn. Like the learning has recently declined because of moving to online classes, but I feel if they mandate the vaccine, online classes will continue to be less of a problem, and a lot of kids won't have to do that. And with them being in school, it will improve their education and many other things like that. The CDC says new vaccines are first developed in laboratories. Scientists have been working for many years to develop vaccines against the coronavirus, such as those that cause severe acute respiratory syndrome, SARS, known as SARS, the Middle East Respiratory System, known as MERS. The virus that causes COVID-19 is related to these other coronaviruses. The knowledge that was gained through the past research on coronavirus vaccines helped speed up the initial development of the current COVID-19 vaccine. That's all I got.
I'd like to use some of our prep time.
Okay, you gonna use that before the crossfire or after the crossfire?
I wanted to use it before I go back to the
Okay.
just
Do you
right
need your full 2 minutes or?
just a
tell me to
portion,
stop?
probably
Can you
close.
tell me to stop?
Okay, yeah, I'll tell you to stop.
Okay, or did you have a portion? It's up to you.
About 30 seconds is what I'm going.
30 seconds? Okay, 30 seconds for the affirmative, negative, right?
Negative.
Okay, just want to make sure. Okay. All right, time.
In your speech, you stated that the vaccine's clinical trials have shown that the vaccines are safe and effective. My question to that end, I have evidence to support it, but is can we trust the companies that are producing and profiting off of the vaccine to provide us with trustworthy and reliable data? In the past, government agencies and private corporations have demonstrated a lack of ethical practices in business and regulation thereof. In particular, pharmaceutical companies have violated federal laws designed to ensure data is reliable and patients are monitored closely in their clinical research. Typically, these companies pay settlements that are only a tiny fraction of their overall profits and issue statements shifting the blame or simply refusing to accept responsibility for or existence of their questionable practices. Lack of governmental oversight and alleged poor laboratory management, patient safety concerns, and data integrity issues at Ventavia Research Company, which was contracted for Pfizer's phase 3 trial, raises questions about the ethics and standards of the companies producing and researching the vaccine. Paul D. Thackert worked with Brooke Jackson, a former regional director at Ventavia, to understand and assess the importance of dozens of internal company documents, photos, audio recordings, and emails in relation to the clinical trial. Their findings are reported in the BMJ, a peer-reviewed report published by the Medical Journal on November 2nd of 2021. In an email Jackson sent to the FDA on September 25th, she outlined some concerning practices she personally witnessed at Ventavia, including participants placed in a hallway after injection and not being monitored by clinical staff, lack of timely follow-up of patients who experienced adverse events, protocol deviations not being reported, vaccines not being stored at proper temperatures, mislabeled laboratory specimens, and targeting Ventavia staff for reporting these types of problems. Jackson received a response from the FDA within hours, thanking her for her concerns and notifying her that the FDA could not comment on any investigation that might result. In retaliation for her report to the FDA, Ventavia fired Jackson the same day. The report also raises questions about the ability of government entities to inspect research facilities and enforce the regulations that protect patient safety and data integrity. According to Elizabeth Wetner, president of Citizens for Responsible Care and Research Incorporated, the FDA rarely has the staff available to show up and inspect clinical research locations. 2 lawsuits against Pfizer also show how the company struggled in the past to research and market its products in an ethical manner. One occurred in 2009 and resulted in Pfizer paying a fine of almost $2 billion and pleading guilty to charges that it marketed the painkiller Bextra for several uses and doses that the FDA specifically declined to approve due to safety concerns. The company paid another $1 billion to settle civil allegations of wrongdoing, that it illegally promoted Bextra, Geodon, Zyvox, and Lyrica, and that it paid kickbacks to encourage healthcare providers to prescribe these drugs. Pfizer did not admit to wrongdoing as part of its settlement. The other case occurred in 2004 and resulted in a $430 million settlement, and Pfizer pleading guilty to 2 violations of federal law. They manipulated studies to support the use of Neurontin. Pfizer paid the settlement, but maintained that the situation did not involve Pfizer practices or employees and took place before Pfizer acquired Warner Lambert, which Pfizer acquired in 2000, 4 years before the lawsuit ever began. I find it difficult to believe that they didn't make any changes to staffing or practices in 4 whole years of owning the company. Pfizer also paid a $325 million settlement in 2014 for civil lawsuits related to those allegations. And of course, they're not the only pharmaceutical company with a checkered past. Johnson & Johnson was the defendant in the 1997 lawsuit brought up by Doreen Coker, a resident of East Texas, who developed mesothelioma as a result of using products from J&J that contained asbestos. She was forced to drop her lawsuit due to a lack of conclusive evidence linking her development of cancer with the talc used in J&J products. But according to an investigation done by Reuters, tests conducted by parties unaffiliated with J&J since then have consistently shown the presence of asbestos in amounts ranging from trace to rather high in the talc used in many of the company's products, including deodorants and baby powder. I don't believe that pharmaceutical companies are intentionally harming people. However, I do believe they make mistakes, and that these mistakes are often swept under the rug, with the company itself doing everything in their power to hide or mitigate the consequences. We see evidence of this in the propagation of the opioid epidemic. Prescription painkillers have become increasingly expensive for Americans. This, combined with the addictive nature of prescribed painkillers, makes it a profitable industry for pharmaceutical giants at the cost of human lives. Regardless of the public image of these companies, they are still a business, and their primary goal and function is to create as much wealth as they possibly can for their shareholders. I concede the rest of my time.
All right, now it's time for the crossfire. So Patrick again and Rich, please.
So you mentioned how the Pfizer vaccine could not be trusted, but you didn't mention the J&J vaccine for the Moderna. Why not?
That is true. I didn't mention either of those. I did mention the court case against Johnson & Johnson, and I believe that that does show their lack of interest in public health. It doesn't necessarily relate to their vaccine, I'm aware, but I believe the ethics of the company as a whole have a lot to do with the products that they make. Does that answer your question? You said, like I said, COVID-19 vaccine trials show that the vaccine is effective. Given what I have stated, do you believe that we can trust the companies producing and profiting off of the vaccine to provide us unbiased and trustworthy data on their effectiveness?
Yes, I do believe so, because I feel as they wouldn't provide a vaccine to the public if the trials before were tested and they were negative, and they happen to have concern for them. So I do believe that the trials before, I can trust them because they brought it out to the public. Another question would be, if the FDA and the CDC cannot be trusted, then who would you recommend we get our information from? Social media?
That's a great question. I don't have a recommendation for who you should get your information from as far as that's concerned. You can of course trust the word of the FDA and CDC. However, I believe it's important to remember that these government institutions have lied to the American people in the past, and they have given us reason to not trust what they say. I think it's important to hold them to a higher standard.
Could I get 1 minute of our time, please?
Sure can.
Thank you.
1 minute for the affirmative, correct? Okay.
I'm done with our time finish this early.
Perfect. Okay, so I have Marshall.
Yes. Am I able to begin, or should I wait?
Whenever you talk about that.
All right. So our opposition, the negative side, mentions how vaccine companies as a business, such as Pfizer, for example, or Moderna or J&J, as a business, they are related to the safety and health of customers, right? But they mention that the vaccines have had some ethical concerns as well as potential issues, which as a business model wouldn't be very good for the vaccine companies, because if you're trying to sell vaccines to people and you're making them poorly and people are having issues, then people aren't going to get your vaccines. So as a business model, it wouldn't be in their interest to have issues like that, and it's best for them to rectify those issues. So I feel like the point that you guys are making about, people or the companies not really caring about their mistakes, it feels kind of weird to me. And then also another thing that the opposition made is that there was a lot of discussion about the ethics of specifically the Pfizer vaccine and a minimal amount about the J&J vaccine, but there was no mention about the Moderna vaccine, which colleges could have that choice of using Moderna or J&J instead, which I feel like makes the entire Pfizer point null, because I feel like there's nothing really stopping them from just not using the Pfizer vaccine for college campuses. Also, I want to discuss about the mandates real quickly, as a point that I kind of want to elaborate further, because we didn't really get a chance to elaborate that a whole lot. But with medical exemptions, all it would be is really just, doctors giving a note for people who may be immunocompromised, which many people are aware that they are immunocompromised. If they're not, there are some easier or there's some more affordable tests to tell. And if they have a suspicion, they could always go to a clinic that may be able to provide that. And our opposition mentioned that some doctors and some health care options are unaffordable for some people. However, there are tests out there that can assure that those people can get checked. And then also I want to discuss religious exemptions as well. We talked about how Title VII makes it where anyone with a serious and sincere belief about religion and how it opposes their vaccine or their views on vaccine are able to decide to not get vaccinated. And we've looked into studies from the CDC that discusses how there have been many other vaccinations in the past, or vaccine mandates in the past, such as tetanus and measles, for example, for more primary schooling. That discusses the rates of people that have exemptions from or got exempt because of religion. And for the most part, or I say for the most part, for all parts, there has never been a recorded case in vaccine mandate history where there have been so many people coming in droves saying that we should, that they didn't want the vaccine, where it makes the mandate null. For the most part, based by the CDC, CDC claims that depending on the state that you live in, roughly 85 to 99.1% of all students that were required to get a vaccine for measles and tetanus did get their vaccine, and the rest were either mandated or were excused because of medical or religious exemptions. And that still makes the vaccine mandate very, very effective because the vast majority of people are mitigating the risk of illness, of sickness, of death from COVID. That also applies to the meningitis vaccine, which is required for students attending colleges already, such as UNT. I remember when I came into college, I had to go get the meningitis vaccine. And most students that do come here do get the vaccine, and if they're exempt, most people are already vaccinated, so therefore they're safe. And that improves the quality of education for those students that are here because they feel safer, because they don't have to worry about getting sick from a very deadly and serious disease, such as COVID. The attack also mentions how COVID as a disease isn't very dangerous for college students. However, there are studies that have shown not only illness of college students during COVID, but also recovering after COVID. There's a lot of side effects that we don't really fully understand yet of getting COVID, such as brain fog, lack of taste, or loss of taste, a little bit of loss of smell, weight loss. I remember, for example, my father, he actually got COVID at the start of this year, and I know he's not a college student, but this is just an example, how he lost 25 pounds while having COVID, and then after the fact, had a little bit of brain fog and a little bit of lack of taste, which college students can also face. Give me one moment. Oh, I'm out of time, sorry. I was about to bring up something, but I ran out of time.
Okay, Justin?
Yes.
Oh, sorry.
You're good.
Okay. One second. Whenever you start talking.
My name is Joseph Putney, and I'm going to discuss the ethical problems with the vaccine mandate. I'm going to discuss two main points. The first is the medical risks that some people may have when receiving the vaccine, and those people's right to decide whether they would risk those side effects or COVID itself. I will then discuss the constitutional right as an American to accept or deny medications of their will. Let's look at the Pfizer vaccine first. Studies have shown that though the risk is low, there have been cases of myocarditis, most commonly in 12 to 17-year-olds who have taken this vaccine. For a person who had pre-existing heart problems, myocarditis related to receiving the vaccine could mean serious injury, disability, or even death. However small the risk of serious side effects like myocarditis showing up, we must consider that these side effects could have long-lasting effects for the people who experience them. For this reason, it is misleading for anyone to claim that the vaccine is safe. There are known side effects that people experience and that are currently being studied. The Johnson & Johnson vaccine is no better. After only a few weeks of distributing this vaccine, after being told it was safe, the Johnson & Johnson vaccine was recalled, as it has serious side effects in some patients for blood clotting. This can be dangerous for many people, but can be especially dangerous for a pregnant woman, as it can result in a miscarriage. It is appalling that the vaccine was distributed to the public without enough testing to know it could cause blood clotting. It also proves that some serious side effects could still emerge, especially potential long-term side effects. For this reason, a person should be able to decide whether they want to receive the vaccine or not. On top of all this, Pfizer and Moderna both have immunity to legal damages from adverse side effects of their vaccines. The vaccine is supposed to be safe and effective, but its manufacturers have removed themselves from liability if things turn out rather different than expected. This is rare, as pharmaceutical companies typically aren't offered much liability protection under the law, according to attorney Rogue Dunn. These companies have been extremely hesitant sharing data and information that was submitted to the FDA to license their vaccine. After more than 30 academics, professors, and scientists from this country's most prestigious universities requested the data, the FDA has said nothing and released nothing. The FDA repeatedly promised full transparency, and yet have given us no information at all. It took the FDA, keep in mind they're very understaffed, from Patrick's speak earlier, only 180 days to make extensive review of the Pfizer vaccine. Yet, after many months of the vaccine being available to the public has been given nothing. In fact, after being taken to court, the FDA requested until 2076 to fully release the data on this vaccine. We should not be obligated to trust a company that is not being straightforward or honest with the public. Next, I will discuss the constitutional right as an American to accept or to deny medications of their will. I will now read a segment from the ruling United States v. Charters trial, dealing with a citizen's right to refuse unwanted physical invasions, specifically unwanted medical treatment. A person has the right to control fundamental decisions that affect his or her own body. This right, whether described as the principle of personal autonomy, the right of self-determination, or the right of privacy, is properly grounded in the liberties protected by the 14th Amendment's due process clause. And this right is also grounded in the notion of an individual's dignity and interest in bodily integrity. With this court case ruling, we can logically presume that a COVID-19 vaccine mandate would be unconstitutional and an infringement on a person's liberty. The vaccine mandate not only contradicts values from the 14th Amendment, but it contradicts values from the First Amendment as well. The First Amendment guarantees Americans the right to practice any religion or non-religion they see fit. If a person's religious beliefs contradict with the intake of the vaccine, they would be constitutionally exempt from the vaccine. Mandating a vaccine upon these people would be a direct attack on the free exercise of religion. This means that for religious reasons, people can exempt themselves from the vaccine. In conclusion, a person has the right to choose what goes into their body, especially when it pertains to that person's health. Furthermore, a forced vaccine would be outright unconstitutional and a violation of a person's liberty. Anyone who wants to be vaccinated or boosted is free to do so, but no one should be coerced by the government or these companies to partake in any medical procedure. Thank you.
All right, it is now granted crossfire time. I need all speakers. And crossfire.
Are you ready?
Oh, sorry, no.
So I
Are you
want
ready?
yes.
Yep.
All right, 1 and 5. 4, 3, 2, 1, go.
Part of the mandate that you have proposed requires a proof of religious belief. Am I correct?
We never mentioned that.
You
no.
didn't mention that?
No,
Okay.
sir.
In that case, I'll ask a different question. What are the specific rates of these adverse side effects from the vaccine?
Adverse side effects of getting the vaccine itself?
Yes.
I do not have that information available right now. I want to ask you a question about constitutional rights that the defense mentioned on your side. You say that people are being forced to get the vaccine. However, you are also given the choice when you're attending college to instead take online classes, so you don't have to get the vaccine, or get exempt from the vaccine. So with those choices in mind, how are vaccine mandates forcing anybody to get vaccinated and violating their bodily autonomy?
You guys kind of mentioned in one of your speeches that online classes were a lesser alternative, and when you're trying to, you have the freedom to try to attend a higher education. So not getting vaccinated, I feel like imposes something on that.
Forcing them to attend online college instead of in-person education, it does limit their opportunities as far as learning goes. I believe would be
Thank you.
What is the likelihood that someone who is vaccinated will contract or die of COVID, whichever you might have available?
I believe the chances are, well, obviously they're significantly reduced when you're vaccinated. As Rich mentioned earlier, there is a 98 to 99% decrease in deaths to those that are vaccinated from COVID compared to those that are not vaccinated from COVID.
I'm curious, if the goal of the vaccines, such as the Johnson & Johnson, was not to protect our communities, don't you believe the vaccine would have not been pulled? It makes it difficult to believe your statement in one of your speeches. The evidence shows that these companies want our vaccines to be as safe as possible. I'm curious as what you mean to when we can't trust their credibility.
I would just say that we can't trust their. Could you repeat the question? I'm sorry.
Yeah, absolutely. So as I was saying, if the goal of vaccines wasn't to protect our communities in the safest way possible, and the Johnson & Johnson was pulled, you did mention in your speeches that companies such as the Johnson & Johnson, which have all been FDA approved, lack credibility. Just curious, should we ignore the credibility even though the FDA and World Health Organization?
I would say that the companies have already lost their credibility due to previous court cases and actions that they've taken in the past to violate federal laws and to put at risk human lives.
There's also been evidence for alternative motives for releasing a vaccine, like
Aye. Affirmative for Ina.
Okay, hi, I'm Ina Ignacio, and I'm concluding for the affirmative side. We have discussed the many reasons why there should be a vaccine mandate enforced across all U.S. public colleges and universities for faculty, students, and staff if they wish to participate in in-person learning. We stated that we do believe there should be both religious and medical exemptions in place for the vaccine mandate. A medical exemption would require a note from a doctor as to why a person is unable to get the COVID-19 vaccine, which can be due to being immunocompromised or having other health conditions. Also, a religious exemption can be claimed by an individual. And we have discussed how this is able to work because there have successfully already been religious exemptions in the past for many other vaccines, such as the measles and tetanus and meningitis. There has not been a single mass incident of large groups of people refusing the vaccine due to fake religious exemptions to the point where the vaccine mandate becomes useless. This has not been proven to be a problem, so it is not of concern. The mandate would still be effective and prevent sickness or death of people on college campuses. Additionally, as it is expected for someone to not want to get the vaccine without an exemption, those who may not be eligible for exemption or choose not to get the vaccine can be offered those online courses, because again, if you choose to be in the space of others at a university and in person, and should care about keeping yourself and others safe. And as we mentioned, for students granted with religious and medical exemption, they would be required to take a COVID test once per week and test negative to continue to attend in-person learning or on-campus living. The same would apply to faculty and staff. They must also test negative in order to work on campus, We talked about how these tests can be found for free, as money would not be an issue for those tests through several different resources. We, all of us here, we all want in-person socializing to happen in the safest way possible, and how it is a privilege to be on college campuses, and we want to provide a safe and protected environment for ourselves and others. With colleges and universities being breeding grounds or heavy spreaders for viruses, and they can be easily spread due to the classrooms and student living and other places, precautions such as the vaccine mandate are necessary. We also gave a good example of a company, Tyson Foods, that displayed how even a company with 120,000 employees successfully got a rate of 96% workers vaccinated, according to WebMD. Of course, we would not be asking to have a vaccine mandate if it were not safe and did not have the necessary research and testing approved first. According to the CDC, scientists have been working for many years to develop this vaccine against coronaviruses, as we did talk about how those severe acute respiratory syndrome, the SARS, and the Middle East respiratory syndrome, the MERS, that are part of the SARS-CoV-2, the virus that causes COVID-19, is related to these other coronaviruses. And so the knowledge that was gained through this past research on coronavirus vaccines helps speed up the initial development of the current COVID-19 vaccines. So the CDC talked about how research was already in process for several years leading up to the release of the COVID vaccine. We, the affirmative side, won this debate because we stated our main points of why the vaccine mandate is safe and how it will be effective. We clearly addressed how what we define the vaccine mandate as throughout the entire debate. We used statistics, examples, and evidence from reliable accredited sources such as the CDC and FDA, and we nullified multiple points of the negative during the Grand Crossfire, such as religious exemptions and Pfizer ethics. As the affirmative position, we also addressed the emotional side of this serious and sensitive topic. We stood for all college students, faculty, staff, and their families that wish to have a safe experience in person. This is a matter of caring for our own lives and others' lives. The vaccine mandate is for the greater good of our communities, and
Time.
thank you.
All right, last but certainly not least.
Let me know when you're ready. Ready? Okay. Once again, our position is not against vaccination in every case. However, instituting a COVID-19 vaccine mandate in all public colleges will not lead to reduction in cases among students, can cause serious side effects, and limit the right to bodily autonomy of our citizens. We started off by mentioning that recent reports show a national decline in COVID-19 cases despite the fact that in-person classes have resumed. This indicates that our level of protection is sufficient. We then discussed the ineffectiveness of the vaccine by providing numerous studies, accredited published articles such as the CDC study that showed most of the Massachusetts citizens who contracted after a recent public event were vaccinated. We also showed that the vaccine effectiveness for infection protection fell roughly from 91% to 66% after the emergence of the Delta variant. We've also talked about the risk of serious side effects such as antibody-dependent enhancement, which can cause severe lifelong health issues, and while the odds of it happening to you are low, it's definitely not something we should overlook when forcing people to get this vaccine. We also covered how the risk for COVID-19 within the college age group is minimal. The next point in our case line was that the healthcare system in America as it stands is convoluted, expensive, and corrupt. Seeing a doctor in America with our current healthcare system is a very privileged opportunity that not every American can afford. Which brings up the possibility of many people getting vaccinated before knowing that they have underlying health issues that may complicate the vaccine effects on the body. In our attack speech, Patrick pointed out the poor laboratory management, patient safety concerns, and data integrity issues at a research facility that was contracted by Pfizer during the phase 3 trials, which again included a quote from the president of the SEER Care, in which she stated that the FDA rarely has the staff available to show up and inspect clinical research facilities. We've also delved into multiple lawsuits Pfizer pleaded guilty to in our attack speech, which further discredits Pfizer as a clean company and proves that they have in the past been at best incompetent in marketing their products and at worst blatantly misleading their consumers for more profit. In our defense speech, Joe brought up that the medical risks for the vaccine and is having on people, providing evidence that the Pfizer vaccine has been shown to cause cases of myocarditis, which can lead to a lifetime of health issues or even death. We also talked about the issues that Johnson & Johnson have had in the past, and that the opioid crisis has shown that pharmaceutical companies can oftentimes have low ethics. The opposition brought up a point about the vaccine companies caring about the outcome of their patients, but I would argue that when every pharmaceutical company is racing against each other, all of these signs of potential side effects are even scarier when you consider the fact that these companies manufacturing the vaccines likely won't be able to be held accountable. If there were ever to be lawsuits against them, this can compound the problem with the lack of healthcare in America, as we previously mentioned, making more people seek medical aid without the money to do so. We also went over some court cases, being the United States v. Charters. The defense speech ended with Joe pointing out that the vaccine mandate contradicts values from the First and 14th Amendments in the Constitution. Because of the recent court cases that rule on bodily autonomy and the contradictory nature of a vaccine mandate within our Constitution, a mandate could quickly become a logistical nightmare to implement effectively. So I believe we won because we provided enough sufficient evidence to prove a vaccine mandate is ineffective, unnecessary, unconstitutional, and could have unforeseen consequences down the road. I also believe that our opponents did not provide enough evidence or counters to our arguments that prove a vaccine mandate for public and private colleges as the best option in protecting us students while attending in-person classes. Thank you.